This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
Did you know that each year more than 600,000 Americans die from heart disease? Some of the biggest contributors include poor diet, high blood pressure, and smoking.
Now, we all know it's not smart to smoke, and we should always watch what we're eating. But there are a few other things you could be doing right now that may hurt your heart, and some of them just may surprise you.
Heart disease is a leading cause of death for Americans, and sometimes the steps we think are helping our heart can actually hurt it. For example, many people think that after a heart attack, they should not exercise at all. However, creating an exercise program with your doctor and sticking to it can strengthen your heart. If you're taking medication for your cholesterol, don't take it with grapefruit juice. Studies show that the juice can interfere with certain medications if taken together. Another common myth is that you'll know when you need to get your blood pressure checked. High blood pressure and high cholesterol are silent conditions, so they should be checked regularly.
Also, it's important to be familiar with the warning signs of heart problems. If you notice abdominal pain, nausea, difficulty breathing, or any unusual symptoms, you should consult with your doctor.
Now, oftentimes heart problems can lead to a heart attack or maybe even a stroke. While heart disease is the #1 killer here in America, stroke's not too far behind, sitting at third. According to the CDC, stroke kills almost 130,000 Americans each year. That's 1 out of every 20 deaths. On average, 1 American dies from a stroke every 4 minutes. That means almost 800,000 deaths due to stroke each year. Now, when we're talking specific stroke cases, a majority of them are ischemic strokes, meaning blood flows to the brain is blocked. Stroke is a leading cause of serious long-term disability.
It's pretty scary when you look at it like that. So we wanted to know how to help prevent a stroke and how to deal with one once you have it. So joining us today to help us is Dr. Michael Murphy, an emergency medicine physician with Peninsula Regional Medical Center. Dr. Murphy, thank you for joining us this afternoon.
My pleasure.
First of all, tell us what is happening to our body when we're having a stroke.
Well, as the camera pointed earlier, ischemic stroke is the most common kind of stroke, and that's generally caused by a blood clot or a piece of cholesterol that can break off, get to the brain, it blocks a blood vessel, and the brain is deprived of blood.
Okay, now I've heard the term mini stroke. What's a mini stroke?
A mini stroke is a stroke that lasts maybe just a few minutes or a few hours as opposed to being permanent. We've kind of gotten away from calling it a mini stroke. We almost call that a warning stroke now. Those symptoms that can last for 1 to 5 minutes is the most common time frame for that. If you notice that, we get worried because up to a third of those kind of strokes can be an indicator that a major stroke could be coming in the next 24 to 48 hours.
Right, I'm glad you brought that up, warning signs. Are there other symptoms we might want to be looking for?
There's an acronym that the American Stroke Association is using. The acronym is FAST. F is for facial drooping, A for arm weakness, S is if you have speech difficulties or notice a friend with speech difficulties, and the T is time to call 911.
Why is time so important?
There's a medication that we use in the emergency department called TPA, and some people refer to it as a clot-busting drug. It's a really great drug to use if it's given in time, but patients have to get to us within 3 hours of those symptoms starting. If they don't get there within 3 hours, the medication is not effective.
So you work in emergency medicine. Do you see often?
Oh, we see strokes daily.
Strokes daily, really?
Yeah. Stroke is a leading cause of disability, I think, especially on the shore. It's something that the medical community here has a really high focus on because we have a lot of diabetes and hypertension, which is risk factors for stroke.
Does it favor one gender or the other?
I think there's a slight favor for men for stroke.
Okay, so obviously prevention is key. So what are some things that we need to be doing every day to prevent a stroke?
I think everyday things that anyone can do. You can institute an exercise program with the help of your physician. If you're smoking, quit smoking. And certainly if there's a risk of it, you should be screened for high blood pressure and diabetes.
Pay attention to what's going on around you.
Yeah.
And check with your doctor. Dr. Murphy, thank you so very much for some important information.
And if you would like more information about what Dr. Murphy had to say or more information about Peninsula Regional Medical Center, just go to WBOC.com, click on our picture at the top of the page.